My primary source in the final moment was Marrow videos only. I have watched Marrow videos. I have prepared an extensive notes of them. When I heard that Marrow has launched SS package, so without any delay, I went for it, and and I must say I did the right thing. So congenital heart disease would be my favorite because I was very weak at congenital heart disease, and the way you dealt, it was awesome. And now it is one of my strongest suit. When it was launched within a day or two, I have bought the course. I have subscribed to Marrow before my final MD exam. So I used to go through, while revising my medicine, I used to go through Nair sir's video. Even Nair sir's videos are very good. Last mock test was a fair representation of the questions which was asked in AIIMS.
Today we are with yet another topper session for you. We are here with Dr. Krishanu, who secured rank 8 in the common merit list as well as rank 14 in the AIIMS list in the first ever INI-SS 2021 exams. Now here we are going to pick his brains, analyze his strategies, know his opinion on Marrow, and many more things. So with this, I introduce Dr. Krishanu, who has done his MBBS from AFMC Pune. He's 2012 batch, and he's done his MD in general medicine from the prestigious UCMS Delhi in 2018 to 2021 batch. So with that, Krishanu, first, just congrats for securing such a prestigious rank and having an opportunity to study such a prestigious branch of cardiology. So my question is, first, why did you choose cardiology? You had an option, you had many other options, nephro, gastro, endocrine. So why cardiology? What attracted you towards cardiology?
So it was right from my initial MBBS days when I used to go to clinic for clinical rounds. I was more interested in cardiology cases, listening for murmur. That was the first thing which fascinated, which got me towards getting into cardiology because I was better than others in my batch at listening at murmurs and another cardiological examination. And then I got interested in ECG while I was in final year MBBS. Then again, the adrenaline rush the branch offers an intervention, the kind of intervention you can do, and timely intervention which can nearly cure patients. So these are the things in cardiology which I actually like.
Exactly. When I ask questions to many people of why do they choose cardiology, intervention is one of the common answers which they give. Now, cardiology is an ever-changing subject. You have more and more interventionalists and interventional branches opening. So, for example, you have structural heart diseases, pediatric interventions. Even if you do a fellowship in electrophysiology, you can become an ablator, you can become a device specialist, you can become a heart failure specialist. The choices are innumerable. And remember, one thing I'm very impressed is you said you are interested in murmurs and in clinical cardiology. That still has a role in the present day generation. So whenever people take cardiology, they automatically think, okay, we'll do an echo, we'll do a TMT, and then we'll post him for an angio. So clinical cardiology is still very relevant. So what was your reaction on scoring such a rank? Were you expecting it?
So actually, I was expecting this kind of rank. To be very frank, I was expecting this kind of rank, and so I was not very surprised, but I was happy.
So your INI-SS exams went to your expectations. So how many questions did you attempt?
So 77 out of 80.
So consistently, I think if you want to score a good rank, you have to attempt at least somewhere more than 72 questions. So if you leave a lot of questions, your rank automatically dips downwards. So after your exams, did you look at our recall sessions?
Yes, so I actually went through it. Before recall session, I was very anxious how the exam went, and there were few questions which I was recollecting, which actually I marked wrong in the examination, and there was a lot of anxiety. Then on the day when the result was declared and still rank was not out, then I said, let's face our fear, and I actually watched your recall session on YouTube, and then I had a fair estimate how many questions I have done right, and I had a fair idea so how is it going to be.
So how did your interviews go?
So interview was fine. In questions in interview were from basics only. So interview was fine. They did not ask any very hi-fi things. It was only basics.
So it's always easier to follow someone. Now, since you have scored such a prestigious rank, we would know how you did it. So, what was your source of preparation? Did you read standard books like Braunwald, Harrison, Perloff, Park?
Sir, I have read 600 to 700 pages from Brownwald, mainly investigations and few chapters in arrhythmias, and that's it. I've not done entire Brownwald, but I have done Brownwald-based MCQs, and my primary source in the final moment was Marrow videos only. I have watched Marrow videos. I have prepared an extensive notes of them. Then during my last days, I'll go through the videos and through the notes, and also I'll do Brownwell based MCQs. Harrison, I did not touch Harrison during my last days, but during my PG days, I have read Harrison Cardiology twice or thrice.
What about Perloff and Park, congenital heart diseases textbooks?
Sir, I have read uh, few topics from Park, which actually come as case in our examination during my PG days. However, it was not possible, and congenital heart disease was one of my weakest topic. And I am very glad that you have taken that topic very extensively.
So it's considered to be a bane of all MD students. It's very difficult to understand congenital heart disease. So again, I'm glad to hear that. So just want to know something. How was Marrow helpful for you?
So Marrow was very helpful to me. My relationship with Marrow is not new. While I was preparing for my PG exam, also in my final during my internship days, I have taken test series of Marrow. So I already had a hang of Marrow, how good it is. When I heard that Marrow has launched SS package, so without any delay, I went for it, and I must say I did the right thing.
I'm glad to hear that. So you have read textbooks, right? You have read at least 600 to 700 pages from Braunwald. So how does Marrow videos compare, or what advantages does Marrow videos offer when compared to a standard textbook like Braunwald?
So textbooks
Because
are very expensive.
you would have heard of the, if you go and ask your seniors how do you get DM, they say that you read Braunwald cover to cover at least 2 to 3 times, read Perloff, read Park. It's a Herculean task. So how does Marrow videos solve it for you?
So with Marrow videos, I was actually assured that most of it was like synopsis of Brownwald, and it was it was in much compressed form, and it was more comprehensive. Because if somebody who is actually doing is describing it to you, then it becomes very easy to understand. And your teaching was very effortless. This is what I'll describe your teaching to be: very effortless. It, it was matlab, you do not feel like you are learning a lot, but at the end of the video, once you see you have so many pages of notes and you have learned actually a lot. And in between those fun facts or those trivia you insert, that makes it really very good.
You like those historical facts.
Yeah, you start with historical fact, and there are few lines which you will say, and those are actually those lines actually sum up the entire summary. Like Eisenmenger's is a fragile is a balanced but fragile physiology. That one line was enough to describe the entire thing.
So one thing I want to stress is with respect to Braunwald, Perloff, or Park, they are big figures in cardiology. Their textbooks are considered to be this gold standard for years together. So remember, these topics in these textbooks are, for example, if you take a topic of angiogram or angioplasty, they are for interventional cardiologists. If you take arrhythmias, they're basically for electrophysiologists and practicing cardiologists. If you take pediatric cardiology books like Perloff, they are meant for pediatric cardiologists. They are not meant for MD medicine or pediatrics PGs. So when we take videos, it's possible for us to come down to a level because we know your level. We have been through that stages and teach you at that level. We can focus on what is important And even I can tell you that these topics are not important, you can completely skip them. That is possible with video. So focusing on important points. And finally, we can give you a perspective on the topic of cardiology. It's not me coming and the regurgitating whatever is given at textbook. It is my perspective on cardiology which I share, my clinical experience, and even it's possible for me to include the latest guidelines. Remember, Braunwald is a textbook which was released in 2018. So if you look at all your chapters, infective endocarditis, pulmonary hypertension, pulmonary embolism, heart failure, even STEMI, your guidelines have changed. And in fact, there were 4 or 5 questions based on your latest guidelines. It is not possible to study in a textbook like Braunwald. For example, you had your heart failure preserved ejection fraction question. So you had thoracic VAT question. So all those were from the latest guidelines, even your non-culprit artery PCI. So these are from the latest guidelines. So that is one advantage which a video-based lecture series can give you over Braunwald or even standard textbooks. Not to say that Braunwald is bad. Braunwald is a sensational textbook, but there is a limitation to a textbook-based learning. That's what I'm saying. So when did you come to know about Marrow? See, Marrow was released sometime around in July. So June, July. So when did you come to know about this Marrow NEET SS program?
So actually, while I was browsing through internet, I have seen a video, demo video, in which they were declaring that they are going to launch SS course, and in which there was a small clip of yours in which they were showing pulmonary embolism being
A baby being delivered.
yeah. So I went through that video, and I was anticipating that in within a month, within a month, SS course will be launched. So I was in touch with your team. I have mailed them, and they have given me assurance that by next. So when it was launched, within a day or two, I have bought the course.
So how long did it take you to see all these videos? So there are around 80 to 81 videos. So how long did it take you to see all these videos?
So if you are free for an entire day, it is very likely that you can see 4 or 5 videos, and you can make comprehensive notes of that also in a single day.
So I think
And
if you are really determined, you can probably finish it off in 1 month, right?
yeah, exactly.
So if you
Exactly.
are
1 month is more than enough to go through the videos and take notes.
exactly. So if you have time, 3 months would be a very comfortable duration to finish off all those videos, right? So, Krishanu, you said Marrow is very useful for your entrance preparation, but we would rather advertise it as a PG learning or a PG teaching program. So, I just want to know, how is Marrow useful for the MD student at the bedside for treating patients?
It is Marrow does not only include fancy stuff or the things which are asked in exams. It also go through the basic things first. They start with very basics, and they pull it up to these to the level to very top level. So it is very useful. Even during my even I have subscribed to Marrow before my final MD exam. So I used to go through, while revising my medicine, I used to go through Nair sir's video at 2x speed, and I would see that topic. I'll finish one like gastroenterology in a day with his videos, and those were actually very good. Even Nair sir's videos are very good, and and all the video of Marrow is from basic level. They start from basic level and they go till the top. So it is as useful to the aspirants as it is for PG students.
Exactly. So we have the new batch of PGs coming in. You have the first year PGs and you have the second year PGs. This is my message to them. See, it is not a super. It's not merely a super specialty entrance training program. It is as good in your wards, in your bedsides. It is to learn a particular topic. If you have a Marrow subscription, you can choose any topic, whether it's nephro, whether it's neuro, whether it's cardio. You get everything together. So, for example, you want to learn something on, say, celiac disease. All you need to do is just type in celiac disease and learn about that particular topic. It's that good, actually. So if you are if you're an aspiring to be a super specialist, you automatically need to have a good grasp on general medicine. So general medicine is your mother specialty. You need to have a good grasp of general medicine. So Krishanu, now you have this 50-30 pattern for the INI-SS. You have the 60-40 pattern for your present NEET SS, and God knows how it's going to be the next year. So what is the importance of general medicine in your opinion?
So general medicine carries a lot of weightage. And before being a specialist, we have to be good physician, as you already pointed out. So we have to be good physician. We cannot cut on that. We cannot cut on our ward times. We cannot cut on our clinical duties. We have to do that with full effort. And once you are done with all those, then it is good. Then it is fine to aspire to be a cardiologist, to be a super specialist. But first of all, you have to have your medicine right. And medicine is mother of all subjects, and medicine has a substantial weightage in your these exams also. So we have to do medicine also very meticulously.
So, as I usually say in my lectures, diseases don't read textbooks and come and present to you. So, for example, if a patient has dyspnea, it's not merely enough that you say this is not a cardiac cause. You have to be able to identify what is its cause, whether it's a pneumothorax or whether it's pneumonia, or whether it's pulmonary embolism. You need to know what the cause is. Only then you can be a confident practicing cardiologist. Be a good physician first. Spend your MD learning general medicine as such. For example, for your NEET super specialty or for your INI-SS preparation, I think it's enough if you give around 3 to 4 months preparation. Would you agree?
Yes,
So three to
exactly.
four, so exactly. So 3 to 4 months of preparation is all that you need. The remaining time, I suggest you focus on medicine, make your basics strong, because unless you be a good specialist, a good physician, you will never become a good super specialist, whether it's a cardiologist, whether it's nephrology, whether it's rheumatology or endocrinology. So that's a very important message I want you to guys to know. So, Krishanu, any particular topics in the videos which you liked?
So congenital heart disease would be my favorite because I was very weak at congenital heart disease, and the way you dealt, it was awesome. And now it is one of my strongest suit. And apart from that, coronary artery disease and valvular heart disease, those have been also been dealt in a great depth. And
So,
dyslipidemias, the dyslipidemias lectures which were uploaded later, those are very good,
exactly.
including latest guidelines, latest drugs, and from their questions also came.
So one thing I want you students to remember is, see, for your congenital heart disease, you have a standard textbook of Perloff and Park. So each topic, for example, a topic like ASD is 50 pages. It's not possible for a student to learn 50 pages for a single disease. That is where a video-based lecture like ours come in, where you can study a topic of ASD in around 80 minutes. At the end of 80 minutes, you'll be pretty confident in handling all questions with respect to that particular topic. And regarding guidelines, remember, as I said, guidelines are meant for guidance of the wise and education of fools. So it's not merely enough that you just follow the guidelines blindly. That is why we have gone in, taken out and dissected the guidelines and made it practical for your clinical use. Not only for your exams, it's made practical for your clinical use. For example, in your dyslipidemia guidelines, we start with why LDL is your target. We just don't say that LDL is your target. Why LDL is your target, why the others have failed in being their targets. So that is very important, so that you get a complete perspective into that particular topic. So Krishanu, suppose you are given an opportunity to roll back the clock and now you are a first year MD PG. So what would be the ideal time for you to buy Marrow?
So in final year, first year it is very hectic, so it is not wise to buy in first year. Second year it can be bought because second year you start having some lesser duty hours and you are more involved with patient and you are seeing patients in the ward and you are reading about the same in your while you come back. So at that time, if you have Marrow subscription, you can go through that topic video at 1.5 or 1.8x speed, and you can also read textbook. It will help you to read textbooks as well.
Would you what was your approach? Suppose, would you recommend that you see the Marrow videos first and then go back and read the textbook, or vice versa?
Sir, I used to see Marrow videos first, then I'll do Brownwall based MCQs of the same topic, and after watching Marrow video, I'll go through notes once, which I have prepared. Then I'll do Brownwall based MCQs, This was my approach, sir.
So you were able to write down all the notes, right, in the
Yes,
given time period. So would
yes.
pre-prepared notes be helpful for you? Suppose Marrow comes up with its notes package. So Marrow gives you notes on cardiology. Would that be helpful? Would that be time saving for
Sir,
you?
I would not say that for me, but for a lot of people it may be. But I am a kind of person who believes in having his own notes. I
Own
write it
notes.
while I'm writing. I grasp a lot. So for me, and it is not very. It does not take a lot of time. If you give dedicated 20 to 25 days, I think entire videos can be listened to, and a comprehensive notes can be made. So
So
2020.
there were extensive, yeah,
Yes, sir.
there were extensive repeat questions, right? So in the present paper, so what was your opinion? Were those repeat questions covered? Because repeat questions are very important. They are like free hits. So were they covered?
Exactly. In later part, you have uploaded MCQ videos, and initially I have not gone through it. I kept on with my preparation, but once I went through one MCQ video of investigation, and I found that it was very good. Then I went through all the MCQ videos, and there were a lot of questions from those MCQ videos.
Would you like any other additional topics to be covered in the present cardiology lectures?
Uh, it is kind of complete. Uh, it is kind of complete, so
So one thing I want you guys to know is that, see, it's not required for you to read the entire textbook of Brownwald. So there are certain topics you can skip, certain topics which appear important, like echocardiograms or coronary angiograms. So I have selected those important areas which you need to know in these topics, and then I have covered those as MCQs. So it's very easy for me to cover those topics as MCQs. So if I start a lecture on echocardiogram, that will never end. It will take hours and hours. But if I select and give you in the form of MCQs, I can focus only on that particular areas. So hence the importance of an MCQ based discussion. So Krishanu, what's your relationship with Marrow been over these days? So you've been with Marrow since 2018, right?
yes, sir. Yes,
So what
sir.
is your relationship with Marrow? Has it been a good
So
relationship?
yeah, it's been a very good relationship. It has helped me during my PG preparation also. I got 149 rank during my PG preparation, and I have taken Marrow test series at that time, and and during my SS preparation, it has been very substantial. It has been the main thing.
So, Dr. Krishanu, at any point of time, did you feel the topics were too vast for you to cover?
No, sir. Once you go through Brownwald and you see number of pages given in Brownwald for a topic, let's say for eco 100 pages have been given in Brownwald, and it has been covered in a few hours in your lectures here and there. So I never felt any topic was it was very vast so that I cannot cover it. Exact weightage time has been given as per the importance of the topic. So like atrial fibrillation being very important topic has been covered in two different lectures and spanning over around 2 hours. But once you go through standard textbook, you will take a lot more time, and you have to and in that you have covered guidelines also, and for guidelines you have to spend additional time, so it cuts a lot of time, so it makes it very handy. And I would not say vast, I would say it to be very precise.
Precise. So, how was your medicine preparation? So, you have told all about your cardiology preparation. How do you prepare for your medicine section?
So for medicine, most of it is what I did during my PG days. While seeing your patients, while coming back to your room, reading it from up to date, reading it from Harrison, reading it from other sources, and as well as I went through NIRS's videos also on top of
Exactly.
that. So
One thing I want to tell to all my juniors, so remember that patients are very important. So you learn a lot from your patients either directly or indirectly. So as one famous person said, listen to your patient, he's telling you the diagnosis. We can teach you everything else, but we can't replace a patient to you. So when you're in your first year or second year, always be with your patients and try to learn from them. That's very, very important. Krishanu, did you use your Marrow mock test?
yes, sir. Yes,
So
sir.
you
I
never
have
have.
given 2 marrow
So what
mock
was your,
tests.
yeah, what was your rank in those?
First marrow test I did not take at exact time, so it was not exact rank. I gave it during my 1 week before my SS 1 week before my INI-SS exam. So in that I got expected rank of 3, and in the second mock test I got a rank of 2.
Too. So I think your preparation was already in the right track that you could get such a good rank. So I'm glad that even those mock tests were able to fairly accurately reproduce your rank.
The last mock test was a fair representation of the questions which was asked in AIIMS, because question in AIIMS, even in medicine section, it was very lengthy, and the question in mock test in medicine and cardiology, it was very representative of the paper, and it was also the kind of 50-30. I think that pattern was also maintained in that mock test. So it was very representative. So it was not very alien for me to go through such lengthy papers, because I had an experience 2-3 days back. So it
Exactly. So
was great.
practice is also very important. If you look at my videos, I've already said it's not only knowledge that's important, it's also execution of that knowledge which is important. So sometimes you might be able to rule out a couple of options and help you get the answer. So I have done a video called how to approach MCQs for your exams. If you look at that in YouTube, you'd find that pretty useful. So it's like how to have a pragmatic and practical approach. Even if you don't know the answer, how you can rule out the options and try to get an answer. Remember, a lot of questions, even if you don't know, you could come to a fairly educated guess and gain the answer. So, Krishanu, would you recommend Marrow to your juniors? Now, you have a couple of juniors now. For juniors from where you did your MD, which is UCMS, and juniors where you're going to whichever institute you would choose. So, would you recommend Marrow to them?
Definitely, I have already recommended, sir.
Exactly. So thanks a lot. So one last question before you leave. So Krishanu, before we leave, so cardiology is a very wide branch. So there are electrophysiologists, there are interventional cardiologists, there are pediatric interventional cardiologists, there are clinical cardiologists, there are people who focus exclusively on structural heart disease. So do you have any thoughts on your future after that, after
So
your course?
as of now, as I do not have exposure to these, I do not know which branch will interest me more. So I'm open to it once I get into cardiology per se, and if when I get exposed to it, whichever field I will get interested in, I'll choose that.
So,
For now,
which college would you like to take? Suppose you got a very good rank. So, which college are you planning to take?
so PGI or JIPMA.
Exactly. So, they are very good colleges. Even you will get exposure in all these areas. For those who are writing exams, especially for your NEET SS aspiring people, one thing I want you to say is where you study really matters. I'm not talking about premier centers. So you need to get hands-on exposure. So it's not enough that you study in a center which does everything and you get to see everything. You need to get hands-on exposure. So there are certain things you cannot teach. Like you cannot teach how to turn a guide to cannulate a certain artery. You cannot teach how to turn your wire to enter into a particular branch. Those are things which you have to do it and then only learn. There's a certain amount of unconscious learning. So you need to be able to do these procedures. So selecting a college is also very important. So you need to do an extensive research, and PGI and JIPMER are fantastic colleges, and I hope you get them, and I hope you have a wonderful career ahead in cardiology. And Dr. Krishanu, please do keep in touch, and we'll be very glad to hear from you in your future. And I hope that we'll meet as colleagues in cardiology conferences and the future. Thank you.
That would be my pleasure, sir.
Thank you.